So this presentation is on dermatitis, eczema, and hives. Um, it's so dermatitis, by definition, it's a skin inflammation, but a lot of things can inflame the skin. We call it dermatitis or eczema if it's not an infectious agent that causes the problem. Many different types. Um, Generally speaking, we can break it down into either a contact dermatitis, which is some sort of an irritant that is applied to the skin that would affect virtually everybody. So, like if you were to spill acid on your skin, battery acid on your skin, you would have a contact dermatitis, an acute contact dermatitis. Sometimes allergens will give it to you, poison ivy, things like that can give contact dermatitis. Eczema is usually reserved for things that are immune dysfunctions. There's hypersensitivity reactions. All kinds of people get it. People outgrow it. Generally, kids' skin is more sensitive to inflammation than adult skin, so it's saying 10 to 20% of all infants have some sort of a dermatitis. That's why, like, diaper rash would be considered a contact dermatitis. So the type 1 reactions and the type 4 reactions really are hypersensitivity reactions or allergic reactions that we talked about before. So eczema is that type 1 reaction. It's a response to a non-threatening stimuli, and it tends to be systemic immune response, and it manifests in the skin. Um, there seems to be a real strong correlation with hay fever and asthma, which are kind of like eczema except on the respiratory system, or the mucosa. So it seems that eczema is that type 1 almost immediate reaction. But eczema and dermatitis are terms that are usually interchangeable. Um, the allergic contact dermatitis is usually a type 4 reaction. So this would be things like exposure to latex in somebody that's allergic to latex, so latex gloves or something like that. And you get the reaction a little bit later, 12 to 48 hours later. What causes it? There's probably a genetic variant. It seems to run in families, and it seems to be correlated with other allergies. They're looking at ideas of dietary fatty acid deficiencies, so that the skin is not the same as in other healthy people. Could be some sort of a T cell, and it's helper T cells that might be a problem. In any case, these people end up with inflammation, and the inflammation ends up in the skin. The allergy-related antibodies are the IgEs, and if they release excessive amounts of histamine, you get too much inflammation. So what triggers it? Could be just about anything. It could be just even rough texture, harsh chemicals. Heat rash would be considered an acute dermatitis. So that would be a big cause. And we'll talk about that in just a second. There is irritation, would be that contact irritant dermatitis. So this would be things like battery acid or harsh chemicals, or All those things that are labeled do not come in contact with skin, flesh immediately. Those sorts of things would all cause a contact dermatitis. Or there could be allergic dermatitis that are contact. So that would be, to a lot of people, nickel is a thing. Now, nickel is found in cheap earrings and cheap jewelry, watch bands and things like that. And people will get a dermatitis at the site where it touches. Various adhesives, a lot of people get it because of band-aids and tapes that are put on the skin. Latex is a very common one. Now, there seems to be like the one that makes the most sense is this whole idea of this acute dermatitis. You get the contact, and then you end up with a dermatitis that follows that. That would be an acute dermatitis. So they're really very itchy. They turn red. They get maybe get vesicles where there's fluid and that kind of thing. But then you can get this subacute dermatitis. So you get these red scratched areas. People scratch and they cause skin damage. It may scale or get plaques on it. There's usually some sort of a silvery sheen that covers. And you'll see it often on the hands of elderly people, and it really isn't very itchy. It's just this fine scaliness that it gets a silvery sheen, and it comes when you've had many cases of contact dermatitis in the same area. So we see it in people that say are coming into contact with the same chemicals over and over again. I have a little bit on my hands from the use of those oh geez, now I've just lost it. Hand sanitizers, because I use that a lot at work. Chronic dermatitis is when the skin actually starts to get thick, and you get these increased markings. It's called lichenification. Lichenification is what it sounds like. It looks like lichen growing on your skin. So the most common type of dermatitis is this atopic dermatitis, and it's on page 201 in your textbook. It's a chronic inflammatory skin disease, the most common type of eczema, frequently already present during the first year of life, and affects more than 10% of children. So this is allergic dermatitis. And it goes chronic on people. So they get this red, flaky skin at knees, elbows, on their hands, on the backs of their hands, ankles. They get this lichenification, and it looks like this. I don't know what's happened to this picture, but there's this whole idea of this red scaliness. You've probably seen it, and it seems to be at bends. Fairly common. This seborrheic eczema is the irritation causes excessive flow of sebum, and sebum is that oil that lubricates the skin. So you get these oily patches, and it accumulates in the folds, in the scalp. So seborrhea, cradle cap, would be a seborrheic eczema. Difficult hydrosis sweating, is really these itchy fluid-filled blisters. It's heat rash. You've all probably seen it. It comes from excessive sweating. it's fairly common. The uh, the new mular eczema looks like ringworm. I actually have a patient right now that we're trying to decide whether she's got a fungal infection, ringworm, or this type of eczema. Um, I noticed it. I talked to her about it, took some pictures of it, and she's actually gone to her doctor. So this is the dyshydrosis. Uh, it, it's you can see the little pustules. This is the one that looks like ringworm, the numelar. So what they get is usually signs of inflammation at that area of contact. It turns red, it turns itchy, that kind of thing. Another type of dermatitis that you'll see, especially in elderly people, is stasis dermatitis. That's when there's poor circulation and their skin goes red or purple, usually around their ankles and that kind of thing. A neurodermatitis is neurologically based, uh, and and it's an over response to a minor injury. So that's the sign of some local irritation, it's local inflammation. So it gets very itchy, and which is called pruritus. It gets very red. It gets edema, right? But that itchiness causes people to scratch, and when they scratch, that irritates the skin more, which causes more inflammation, and that it becomes kind of a self-fulfilling thing. Another problem is that if the skin gets broken, you get secondary infections possible. Now, then that wouldn't be a dermatitis, that would be an infection, maybe cellulitis or something like that. Um, so, so what do these people have to do? They have to avoid the triggers. So if you have a latex allergy, then you avoid latex. You know, the people seem to benefit from dietary supplements, moisturizer. They can take medications. These topical immunomodulators they're creams that aren't corticosteroids that try and calm down an overactive immune response. The anti-inflammatory, tries to stop inflammation by affecting the immune system, but topically it's a cream. People take antihistamines, things like Benadryl and that, because histamine is a mediator of inflammation. A lot of people, especially with chronic, use corticosteroids as steroid creams. With corticosteroids is that they absorb through the skin, and they become the same as if you take prednisone or something like that, and they increase blood sugar and they cause gluconeogenesis, which takes collagen out of the dermis of the skin and the adventitia of the blood vessels and the osteoid of the bone, and turns it into sugars. So people end up with thin skin and bruising and bleeding and osteoporosis and high blood sugars. So there's risk to it. Steroids are also an immunosuppressive drug, so the corticosteroids. So it makes people more prone to infections and things like that. So they're effective, but they have their risks. So can you massage these people? It's a relative contraindication. Depends on whether, like what stage it's at, whether it's acute or chronic, whether there are pustules, whether there are breaks in the skin, that kind of thing. Now, related to this are hives, urticaria. It causes heat and swelling and itching on the skin, and it's caused by a lot of the exact same things, but it's much more localized. So it's the triggers vary; they're all over the place. It's some sort of a reaction and that causes histamine to be released in the superficial fascia or in the skin. And so you get this local inflammatory response. So they can be really acute, short-lived, and it's triggered by allergies. It can be triggered by infection or some sort of skin irritation. Sometimes it's mechanical. The cholinergic hives are associated with acetylcholine, and you get all these little tiny bumps. It can be really quite severe, and so people break out in hives, and it can be a systemic reaction to it. There's this idea of physical hives. The mechanical triggers do it. Now, it seems to also be related to stress. People that have this dermographia, which means writing on the skin, it seems to get worse in periods of high stress. So it's some sort of an overreaction to a fairly minor mechanical trauma. I've had many patients with it, and my own mother has had it. And actually, here's a couple of pictures of it. This first one is a very dramatic one where you actually write hello. The hives come up any place that you make a scratch, and it looks like that. I've actually seen it where I've done that to people just to demonstrate that it's what's going on. Most of the time they present with something that looks like this one down below, because it gets itchy and they scratch, and then they get the hives where they've been scratching. As you saw, it turns red, it gets even itchier, and the wheals may join into these large patches. And because it's an inflammatory response, using anti-inflammatories, antihistamines, seem to be the best thing to do. Now, probably not a good idea to massage somebody, especially if they're having dermographia, if they are sensitive to things. So I would massage over the hives, and if it's acute sort of hives, then I would probably avoid it. Again, this is typically what you'll see, and you will see it a lot on your patients throughout your career. People get this.